Hi, this is Dr. Brian McDonough with another edition of Staying Healthy Together. One of the things we don't think about with COVID is its impact on the entire world and the fact that we are a global society. So it's worth taking a second to take a look at what's happening around the world, especially particular hotbeds, because it can impact everyone. First of all, the number of cases in the world right now are up about 27%. The number of deaths worldwide is up 12%. The hotbed at the present time is India. In India, right now, we're getting new cases topping 300,000 per day. Now, the worst part about what's happening in India is they don't have enough oxygen tanks. So people are essentially suffocating as a result of the fact they can't get oxygen. Just imagine that, being hospitalized, struggling for breath, having COVID, and not being able to have oxygen to support. This is how devastating COVID can be. So what does this mean for the rest of the world? As India struggles with this and as they try to battle through it, what's it telling us? The biggest concern for the rest of the world is how tied together we all are. So if you're somewhere in the EU, you're in Brazil, you are in Africa, what would happen is that if there are COVID cases at an overwhelming number in a particular part of the world not being controlled for whatever reason, COVID can mutate. Now, right now, the mutations we have seen are responsive to the vaccine. So what we got to do is get out and vaccinate the world. If people get vaccinated and continue to social distance, wear masks, and take those public health efforts, you theoretically can keep COVID down. You keep it down, the chance of mutation goes down. The fear all of us have is, what if a COVID mutation becomes resistant to the vaccines we have? If that's the case, we're going to need to continue to vaccinate everyone on a yearly basis. And again, that's really tough to do throughout the world. Now, hundreds of years ago, people didn't travel the way they did, so things would happen in pockets of the world and more or less stay there. The reality is we are connected as a global society. We are connected as people. I keep saying our differences are not as big as our similarities. We like to focus on our differences country to country, but the reality is we're similar, especially anatomically and physiologically. So what's happening in India, not just devastating in India, it's devastating for all of us, and we have to think that way.